welcome back to the studio. Hello on a wonderful Wednesday with Annie and Constantine right here. And yes, indeed, hope you're having a fantabulous lunchtime.
That's right, fantabulous indeed. Now, earlier on, we saw the clipping for Captain James Anthony Tan, the entire launching, isn't it?
And you know, he really reminds me of that movie, Top Gun. You know, Tom Cruise. He has that Tom Cruise appeal. You know, he's a pilot. He flies.
You know, you do realize if he hears you right now, he's not going to go to sleep.
Yeah. Probably. Yeah.
There you go. He's not going to go to sleep when he hears that one. Tom Cruise, Top Gun. All right. So from Tom Cruise, Top Gun, and Captain James, we move on to a little health topic that concerns women out there. For couples, of course, this is a very important topic. IVF, and is this going to assist you in your pregnancy? How successful is this procedure in Malaysia? Do people really go into it? How expensive is it? Let's talk to the doctor in the studios. Now, right before that, a quick note on IVF itself. The first successful birth of the test tube baby was Louise Brown, which occurred in 1978, and Louise Brown was born as a result of a natural cycle IVF.
Wow.
And the psychologist who developed the treatment, Robert G. Edwards, he was awarded the Nobel Prize in Physiology or Medicine in 2010. Amazing indeed. So let's get our doctor into the studios to find out more about IVF. Dr. Haris Hamzah, consultant obstetrician and gynecologist and fertility. There you go. Good afternoon, doctor.
Good afternoon.
How are you doing?
Very well, thank you.
All right, good to hear from you. Let's talk about IVF itself. What entails the process of IVF?
Well, IVF is a process that involves stimulating the woman's ovaries to produce more eggs. And at the appropriate time, usually about 8 or 9 days of stimulation, when the eggs are deemed mature, they are collected, and then they are fertilized in the laboratory with the husband's sperm, and thereafter the embryos are then put back into the womb. And that whole process from start to finish is one cycle, basically from the start of one period to the next period, or if she falls pregnant at that time.
Right. Okay. And this is a very painful process for a lot of women. Can we just find out, like when you recommend a woman for IVF process or the whole treatment itself, is there a particular criteria that you look out for when the woman goes through a full checkup for why she would want to opt for IVF?
I think basic causes for IVF or the need for IVF are firstly those women who have tubal damage, fallopian tubal damage, whether due to infections or endometriosis, or those who have severe ovulation disorders, or those whose husbands have very severe sperm problems, or those who have failed simpler treatments before, or now in this more recent times, you need IVF to do certain pre-implantation genetic screening procedures.
Right.
So those are some examples where IVF is an absolute need.
So the men would have to go for checkups as well?
Oh, absolutely. I think this is one of the main things that should happen at the first instance when they come and visit, because men account for up to 30% of the fertility problems in couples.
Okay.
So it's a very big percentage, really.
So we're looking at poor sperm count. Is that it?
Yeah, not just poor sperm count in terms of quality. You have things like count, the motility, and morphology or sperm structure. And
endometriosis is also another problem among women for IVF. Would that be correct in assuming so?
That is true, because endometriosis is much more common these days. And next to infections or pelvic infections, endometriosis is probably one of the more significant causes for fertility. And it goes through various stages in fertility, in endometriosis. The more severe grades of endometriosis, of course, you need to deal with medically or surgically, and ultimately they do end up needing IVF.
Now, how do you prepare for IVF? I mean, is there a certain diet that you need to take, or, you know, what are the preparations before?
I think good question. I think general health has to be good. And for women, if possible, an ideal weight would be as well a criteria that you want to consider. But it's always quite difficult in certain categories of women, especially those with some ovulation disorders like polycystic ovarian syndrome, for example, where weight is an issue but difficult to control.
I see.
So you want to have good health, good weight generally, be off certain types of medication or herbal preparations which might affect other hormonal stimulation cycles.
Okay. Well, we are going in for a quick break right now, so stay with us. Quick break coming your way with hot flavors coming your way with, I believe, Zamil and a couple of donuts. So let's take that and we'll see you in a bit with the doctor in the studios. Right, so there you go, Zamil and yummy, yum, yum, delicious donuts.
The after effects of taking donuts, you can see on the smile on his face. It stretches all the way to his ears. It's just crazy.
I have to find out whether that was the smile. All right. So 2282-8578, 2282-8579, Malaysia. Give us a call if you have a question for the doctor. We're talking about IVF, how that helps you in terms of pregnancy, as well as, you know, if you and your hubby are looking at pitter-patter in the house, this might be a way to go. I do believe we have a Farida on the line to talk to us, or rather ask a question or two. Hi, Farida.
Hello.
Hi, good afternoon.
Hi, good afternoon.
Okay, do you have a question for the doctor?
For doctor. Sorry.
Go ahead.
Okay, doctor. I already have a 10-year-old daughter, and me and my husband and I, we have planned for this our second child since she was 5. But I failed to conceive naturally as I did with the first child. So, should I try IVF, doctor?
Okay. So you already have a child, yeah, Farida?
Yes.
Okay. All right then. We'll get the doctor to answer the question. Thank you so much for the call.
Okay, no problem.
Okay.
Doctor?
Right. So I'm assuming she'll be in an age group of about mid or late 30s, and she's waited quite a long spell from the first child to the second. I'm assuming she hasn't done any investigations before. I would advise her to see a fertility specialist to try and identify if there's a particular problem that's causing this difficulty. And more important though, if it's been this length of time and her age is approaching late 30s, going on to 40, it becomes more urgent that some active treatment, even up to and including IVF, should be considered. Because as they get past 35, the fertility rates drop rapidly, and certainly at 40, the chance of natural conception is much reduced. So without knowing the ultimate cause that or problems that she's having, I do believe she's advised to see someone.
Okay.
Okay.
So do a first checkup, and then after that maybe consider if she is eligible to take up an IVF treatment. Yeah.
Certainly.
Okay. So Farida, I do hope that helps you. All the best, of course, from all of us. All the best. We do hope that you're able to be successful in whatever that you're doing right now. Now, when we talk about stimulation of the ovaries, doctor, earlier on you were mentioning that the whole treatment is to stimulate the ovaries. Is there a particular side effect that would occur to the woman who's going through the treatment?
All right. Briefly, stimulation of the ovaries is something that is required to produce more eggs. So it implies, therefore, that you have to give a certain dosage to achieve that result.
Right.
Now, this dosage is tailored basically on the number of potential follicles we see in the ovaries, and the age of the patient, and the regularity of her cycles. Okay. So when we give a dose, it is usually designed for that particular patient. And the reason being, one of the biggest complications or dangers in stimulation is hyperstimulation syndrome, they call it. So this is where either a patient is hyper-responsive, or because of the certain dose that was given, they do respond extremely too well. And the dangers of this condition are really quite significant.
Right.
So with that in mind, all our patients' stimulation cycles are planned, and the dose are regulated accordingly to give an optimal response without overstimulating.
Okay. Now we do have a couple of slides that we're going to be showing everyone on the screens right now. So, doctor, maybe you can explain a little bit about this, the whole what we're looking at right now.
This slide is an example of what we call pelvic adhesions, and you see in the middle there's the womb, and to the side is the tubes which are hidden by these adhesions. This is particularly so when you have patients who've had pelvic infections before, and if they're not treated adequately enough, this is the result of it. And when you have conditions like this, it may obstruct or distort the tubes, and therefore have difficulty with getting pregnant.
Getting pregnant itself. Okay. And we also wanted to ask, off camera, I know Constantine and I were talking about friends of ours who've gone through IVF, but they ended up, miscarrying the whole thing. Maybe you can just tell us a little bit about, what happens. I mean, what causes this miscarriage?
Okay, firstly, you have to understand, with IVF, we relate miscarriages usually to some abnormality.
All right.
All right. Now, with younger patients, miscarriage rates are not an issue.
Okay.
In general, miscarriage rates are the same whether you do IVF or if you conceive spontaneously. But it's more significant at an older age, whether it's IVF or natural conceptions. The older the patient is, the higher risk of miscarriage.
Right.
And again, like I said, this is related to abnormalities. I mean, you know that if you're 40 and above, there's higher risk of Down syndrome, for example.
Yeah.
That's just one that we know of. But at the same time, there are other chromosomal conditions which you also experience at an older age group. And these are the things that relate to a higher incidence of miscarriages.
Okay. Final question, real quick now. How about the, how expensive is IVF?
Okay, you had quoted a certain figure earlier on.
About 15 to 20K. I might be wrong.
I think in general you're right.
Okay.
But in my own center, for example, we have a package which starts at 8,008.
Oh, wow.
And the actual pricing is fixed at that rate, but there is an adjustment for the dose requirements.
Right.
So our patients generally don't spend more than 12 to 14,000 at the end of the day.
Okay.
And this is also related to the fact that we've been at this for 26 years as a pioneer in IVF in the country.
Okay.
So it's giving back to the patients that the cost has been actually lowered.
Okay, fantastic.
All right, so Doctor, thank you so much for joining us this afternoon, sorry. It's been wonderful to have you here. We just hope that anybody who's listening to us today, all the viewers out there, you get a fair idea of what to do, what to go through when you, when you decide to go through the IVF treatment. Thank you very much, Doctor, for your time.
You're welcome.
For you out there, don't go away. We have Dinas Mokhtar in the studios to tell us more about her being a wife, mother, and a businesswoman herself. So stay tuned. Quick breaker coming your way.